Delaware Health and Social Services Secretary Kara Odom Walker joined Governor Carney and other members of the Family Services Cabinet Council Tuesday night, March 12th, for a community discussion at the Route 9 Library and Innovation Center in Newcastle.
Another public meeting to talk about the work of the Family Services Cabinet Council. The Family Services Cabinet Council was set up initially probably about 20 years ago or so by then Governor Tom Carper. I thought it was a really good idea to reestablish him, and it has really been serving us well.
So at the Delaware,
Secretary Walker gave an overview of how Health and Social Services is implementing trauma awareness across the department, with nearly 1,000 employees trained at this point.
We have a train-the-trainer model where we're working to make sure that staff are able to pass along these skills and talents. So 25 of our staff have been trained by an amazing partnership with Wilmington University. They're 54-hour trainings. These are completely voluntary opportunities. People sign up for it. We've trained almost a quarter of all of our agency staff.
She also joined Delaware's Chief Information Officer, James Collins, to talk about sharing data across agencies.
And to reach out. One example that has highlighted this need that we are looking at as a possible model for us in the state is what West Virginia has done around tracking overdose deaths in their state. And what they did was a look back. For every overdose death, they used that as an opportunity to identify what the risks were, what the gaps in care were. And this is something that's been highlighted by the Lieutenant Governor's work with the Behavioral Health Consortium, that we realize that we really need to track the system level gaps in care. And we have this information, it just is not talking to one another. And that's whether it's in our Medicaid claims data or corrections data or behavioral health treatment. We know that people who are at risk are asking for help or are landing in our systems and need to identify those gaps. So we have prescription data. It doesn't necessarily tell us when someone's been hospitalized or been in the emergency room. It certainly doesn't tell us a lot about where they live and who they are. And so West Virginia used this look back for every overdose death to say, where are these opportunities to intervene? Where can we be strategic about creating a safety net in the system? And again, this is a model that we're hoping to execute on that will allow us to test out what could work here for us to identify those same kind of risk factors. So this is just one example, but we have a lot of others that I'm sure many of you have dealt with as you work to coordinate across state agencies.
Director of the Division of Social Services, Ray Fitzgerald, and Renée Beaman, Director of the Division of State Service Centers, presented on the Golden Ticket pilot at Porter State Service Center. The Golden Ticket gives clients the chance to find all their needs in one place.
We formalize the referral service, and we include case management, tracking cases, real warm handoffs to other agencies so clients aren't left in limbo.
We have 15 state service centers throughout the state, and they're often considered the first point of entry for individuals who need some type of social service assistance. Many of them come in with challenges such as homelessness. They need to get their Medicaid open. They have problems with their children, food, various complex issues that we work intensively on a 30-day case management. We pull together various agencies and organizations, and what we do, we try to cut through that red tape for them and help navigate them through the system so they can have a positive outcome. So how well did we do? This has been since about August or September of last year. On an average, Porter State Service Center sees about 314 families. So for this pilot, again, we're looking at individuals who have complex needs. We had 175 clients. The average number of barriers that they had were 4. And the agencies, as Ray had talked about, we were able to pull together about, average about 5 agencies were involved at the same time within the 30 days for that case. And of course, we wanted to make sure that we were doing what we needed to do to meet their needs. And you can see the outstanding satisfaction survey. So this is something we're really excited about, and we're looking forward to having more families that will have such positive outcomes.